So today, the reason why we're having, today is what, September 6th, 2023. We're having this in-service on dehydration and UTI. Typically, we have an in-service based on what our needs in skilled nursing. And recently, we had a resident who had dehydration, went to the hospital, was diagnosed with UTI. And so if we want to get better as a facility, as a unit, we need to understand how to prevent these things from happening. And we can also take a look at case by case whether this was something that's preventable or this was something that, is this a resident that might have been declining? Regardless if the resident even is declining, some of these incidents can be prevented. And just depends on the severity of their decline. So let's talk about UTI real quick, and so we can tie these two together, these two diagnoses, dehydration and UTI together, and so we can understand why this patient actually had both of these. And so if we look at UTI, is an infection of the urinary tract, and for most cases, the females and the elderly are the highest at risk, and we say they're the highest because of how the structure of the urinary tract is made out. So for example, the female urinary tract is a lot shorter than the male, and therefore the bacteria can easily travel faster, and so that's why the incidence of UTI is greater with female. Now with male, certainly we can get an infection as well, but the incidence is a little bit lower, just because there's tendency to urinate some of this bacteria out. Okay. Also for the elderly, they're at higher risk because they're older, right? That's the easiest answer I can give you. But to tell the truth, because you're older, you have decreased hydration status, right? Your ability to drink is a lot less than somebody like Oscar over here, who's always drinking, right? And fluid is really a pertinent and very important factor here when it comes to a UTI, okay? And the less you drink, the higher risk is for UTI. And so we want to make sure our residents drinking, but unfortunately with residents that are declining, getting older, they get full pretty quickly. And they really don't feel like they want to drink anything. And some of your residents could be like, hey, I don't even want to drink water. I want to drink Coke or soda, or beer or whatever. But they want something there that's a little more flavorful, right? Also, residents take medication that can factor into increasing their risk for a UTI, right? Decreased mobility also puts you at high risk for infection. Because if you're just sitting there, for example, if you're just bedfast and you're not walking around, you're not moving around, you're not being repositioned, the urine that's in your bladder could just sit there and stagnant, right? And so the frequency or the incidence of infection is higher, and with these residents. So we're gonna get her to come in here. So we get her to come in here. Okay. So not only women are high risk, certainly the elderly are high risk. You have predisposing medical condition too that puts you at higher risk for UTI. Okay. So what is the signs and symptoms of UTI? Okay. Now the easiest way to kind of look at this is we want to break it down because, hey, come and join us for in-service. You can clock in now if you want.
Yeah.
And so for the elderly, it's a little bit more different than your younger population, right? 99% of the times your elderly is going to show increased lethargy, right? If you're coming in, if you take care of somebody who's 23 years old, whatever, they might have, maybe they're a quad, right? You're a nurse, you're a CNA, you're a caregiver, and you're trying to determine what's the difference in symptoms with the younger population and the elderly, right? You have a 23-year-old, you have a 69, 70-year-old resident. Most of the time, your elderly population is gonna be confused, is gonna be lethargic, okay? Now, is that gonna be the same for your 30-year-old patient, your 23-year-old patient? Maybe not. They might exhibit flank pain. They might exhibit fever, right? But for the most part, when you're looking at a urine, regardless of who they are, If there is infection in there, it's going to be cloudy, right? Maybe not, but if you do a culture, there's going to be an increase in bacteria on there, right? The smell of the urine can be an indication that there's an infection on there, right? The color, right? I said cloudy, but it also could be a little amber, right? There could be some bleeding in there. Infection can cause some form of bleeding, and that could manifest itself in the urine, the different types of color, right? Bright pink, bright red. Also, like increased frequency. If you're getting up more frequently to use the bathroom, maybe you've been with this patient for a whole month, right? And they're only usually peeing one time a night, right? In the middle of the night from 10, you work from 7 p.m. to 7 a.m. You notice that the patient is only peeing once or twice a night. Now they're getting up every 2 hours. You know, you might want to mention, and then maybe you notice that they're a little lethargic. That is one symptom of a UTI. Doesn't mean they have a UTI. Now, if you have multiple symptoms of that, then that's a clear indication that they have a greater chances that they might have a UTI, and that's something that you need to report. Now, you might find one symptom in your shift, right? Hey, they're a little tired today, and they might not be peeing more frequently. But then the next shift is going to pick up, hey, you know what? They're voiding more frequently. So that's two symptoms already, right? So at this point, if your nurse is a good nurse and they're able to put 1 and 2 together, they're going to be able to pick this up. The nurse should be trained to say, hey, one symptom doesn't mean that they have an infection, but they are trained to look for more symptoms and do labs and do all that other stuff. Okay. So that's why I said multiple symptoms will indicate a urinary tract infection. On the other side of that, one symptoms being, don't be pushy as a caregiver or as a nurse saying, hey, you know, I got one symptom here, he's got an infection. I know he's got an infection, okay? Because a lot of times maybe they do, but you can push fluids and get rid of the bacteria. If you over treat something, especially a bacteria, and you give too much antibiotics, you get what's known as MDRO, multi-drug resistant organism. And you all know that, we talk about it all the time, and we're trying to prevent the spread of that. That means that bacteria has grown significant enough that there's very little less treatment for it. Now, most of the antibiotics that's being used for it is no longer effective, and so they're known as superbugs, because you know, if you get it, you might not have a treatment for it. You might have one, but there's going to be, significant side effects with these, high-powered antibiotics that's available, for these superbugs. Okay, so those are signs and symptoms of, a UTI. For the elderly, like I said, the main focus for them is change of condition, confusion, lethargy, fever. Maybe they don't want to eat more. Maybe they don't want to walk. So those are clear indication of somebody who might have a UTI. Okay, acute delirium. Sometimes you get this phrase kind of thrown around. I mean, acute means it's something kind of like that happened just recently, right? Short term, right? And compared to somebody who's more chronic, right? So have acute delirium. That means that it's something that you're gonna be able to reverse later on. So somebody who has an infection might have acute delirium, is what you might hear. So that means that it's something that happened currently, and you might be able to reverse later on, okay, with the use of medication or whatnot. Okay, so what's the treatment for UTI? What can we do for resident who has a urinary tract? What can we do? Anna, what can we do?
If they've been diagnosed, then of course antibiotics. But if they haven't been diagnosed, maybe some cranberry juice, maybe some water, getting them to start flushing out.
Yeah,
Some of
absolutely.
that, but cranberry juice is the first
Cranberry juice?
defense.
Yeah, antibiotics certainly. A lot of times when we're caregivers with CNA, there's not much we can do in terms of antibiotics. But what you can do as a caregiver with CNA is increase fluids. This is good for treatment, and this is good for prevention. Okay, as you move along, and somebody, hey, what can I do for this resident to prevent UTI? Fluids. What can I do for treatment for these residents? Fluids, right? Same thing with ambulation. It's prevention. It's also a treatment, right? The more you move around, the better you're going to be. You increase your circulation. You increase your ability to get rid of these fluids, right? And so you drink more. And a lot of times these treatments are congruent with prevention as well, right? So treatment, antibiotics, increase fluids, and then resting as well is good as well, right? Let's look at prevention. As we mentioned, fluids is one of them. What else can we do to prevent an infection for a resident? change more often. You have an incontinent resident, changing them frequently, or when they get wet, because you could have a very acidic urine in there. That can eat up to your tissue. You can eat up to your brief, and that can go into your urinary system, right? And not only that, you don't want that urine to kind of sit around for a very long time. It creates moisture. It harbors bacteria to grow even more. Okay, so provide changing more frequently. When it comes to pericare, what can we do to prevent infection from happening?
You make sure you're you're cleaning the right direction.
The right direction for females, right?
Yeah.
Right? From, what do you want to do? Front to back or back to front?
Front to back.
Front to back, that's right.
For a second.
Okay, you want to go from front to back. You never want to go from back to
Back,
front,
back,
right?
front.
Female residents, you're gonna introduce the bacteria back into the bladder. You're gonna create an even worse situation. Okay, for male, you wanna make sure you do the pericare correctly. You wanna wipe the tip, and also increasing fluid is important. But there's not much you can do for male resident, but there's specific thing you can do for female, and as what she said, the technique from front to back. All right. What else can we do for preventative? What about the type of drinks that you're giving? I don't want to drink water. What can we give them? She mentioned capsule, cranberry capsule.
I did say cranberry juice.
Cranberry juice, anything that's acidic, right? It doesn't have to be cranberry. If the resident likes orange juice, right?
Orange
it's
or
acidic.
lemon.
That's really good. It sits in your bladder. It kills off some of this bacteria. But that's how cranberry capsule works. Really, is acidic, and it prevents infection from happening. Now, it's prevention. It doesn't mean that it's 100% pure, and it can prevent it 100% from happening. It's always gonna have to be, if you have prevention in there, you're good, you have good fluid intake, you can prevent this infection from happening, right? And good pericare, right? All those put together. And then avoid holding your urine. You know, if a resident is sitting there wanting to use the bathroom, obviously if you keep holding it for long periods of time, you're gonna have increased risk of infection with that, okay? Not only that, you're gonna have pain and everything else that's gonna go along with the resident. Today, I got a complaint from a resident from one of our NOC staff, and she said, I have this bladder pain because the CNA didn't want to change, didn't want to take me to the bathroom. And so when I was talking to the resident, I said, well, she came to you, and what did you tell her? She said, well, I got to use the bathroom. I said, okay, well, and then what happened? She said, I told her I need to use this wheelchair to get in there. And then she told me, no, you don't need the wheelchair. And it's a registry, so she doesn't really know like what's going on. And so I said, okay, well, she said don't use the bathroom. And then what happened? What did you say? It's like, well, I said, I didn't trust her after that. And I said, never mind, I don't want to use the bathroom. So there was a communication issue breakdown there. It wasn't, I'm not gonna say it's the resident's fault. Definitely the CNA should have made an initiative of saying that, consult with your resource RN, if there's an issue there. But in any case, she held her urine, and I said, well, didn't you ask for somebody else for help? No. I called the nurse for a pain pill. I said, well, did you tell the nurse, that you were having pain and the CNA wasn't helping you? No, I was just really happy to get the pain pill. So I was like, okay, so you didn't call it any other time? No, I was just having pain the whole night. I was like, oh my goodness. All right. Well, I told her I promised I would talk to the CNA, but certainly moving forward, that the resident should have probably said, hey, you know what? I really need to use this walker. I need to use the bathroom, and maybe tell the nurse. In either case, it's our job as CNAs, as caregivers, to focus on the resident. And if you don't know the baseline of the resident, ask, right? And so this resident held her urine and was having pain basically. Now, is she gonna have a UTI? I don't know. And does she have a high risk for UTI after holding all that urine in for 8 hours? Probably. So in any case, that's just a communication error on the CNA side, on the staffer side. Okay. All right. Any questions on the UTI part? Right. Again, there's a lot of factors that could happen with somebody who is high risk for UTI, especially in the elderly. If you look at our elderly here, if you look at the resident who recently went to the hospital, room 32A, right? I'm not even gonna mention his name. 34A, right? He's been declining. And I'm gonna give you the problem, and then we have to look at to see whether we could prevented it. He's been declining. He's got a personal caregiver, and he's not drinking as much. Now, what could we have done to prevent this from happening? You know, we're looking at his diet and his weight. It doesn't seem like he's losing weight. It looks like it's pretty much the same. So which means maybe he's eating about the same. But I think the issue had been fluids, and the fact that he's not drinking as much. All we could really do is pretty much like document as much as we can. But if we're looking at preventing this from happening, you know, and the notes indicate that we've been pushing fluids, and whether that's happening or not, the fact of the matter is he went to the hospital for dehydration. Secondary to that, he had a UTI, and that's where I'm at right now in terms of, you know, trying to explain to our staff that when you become dehydrated, things gets really concentrated, and if you do a culture in that urine, you're gonna have a concentrated urine, and it's gonna equal to a UTI, right? Now, if you push fluids, well, he's gonna go back to baseline, and the infection will go away, maybe. But the fact that we've already cultured the urine, we have to treat it with antibiotics. So he comes back with dehydration and infection. But you know, for the most part, you know, when you're culturing the urine and they're asymptomatic, you know, it's likely that the patient is a little dehydrated and they increase fluid, they're going to be just fine. You know, and 99% of the time, if you culture anybody's urine in our skilled nursing, whether they're symptomatic or not, and we proved this because we've done it before, right? Family members can, you know what, my loved one is lethargic today, I want to get a urinalysis. Yeah, you can do urinalysis, you're going to get some bacteria on there, you know, and so that's why we say you have to have more than 2 or 3 symptoms to treat the infection. So going back to 34A, the problem was dehydration, not the UTI, okay? Because he got the diagnosis of UTI from dehydration. So we should have pushed fluids on him, and then if he was indeed declining, we can just chart that he's unable to drink or has a decrease in fluid intake, okay? And but the notes indicate that he was drinking adequate fluids, and his weight is pretty much the same. So I don't know what to say in terms of that. But on our end, definitely the fluid with meals and in between, like passing meds with the nurse, should have been a focus with this resident. Okay, so let's take a look at why residents have a decreased ability to swallow. A lot of times, you know, the resident with age and the taste, right? And I mentioned this already in terms of dehydration, is that not only they stop eating because the food doesn't taste as good, their taste has decreased, right? It also affects their swallowing, right? Sometimes they can have pain even just swallowing, right? Somebody who's in hospice or declining, you can have these symptoms, right? And also your ability to kind of synthesize the food that you're eating or the fluid that you're drinking, right? With patients that has issue with fluid retention, right? You could be third spacing, right? So even though you're drinking a lot of water, and then you feel like, hey, he's drinking a lot of water, but if you're having edema, that means that you're not really retaining those fluids to go back into your system. It's just sitting in your tissue. So yes, you're drinking enough fluid, but it's sitting in your legs, it's sitting in your arms. You have all these edema. It does you no good, because basically it's not getting into your bloodstream, and your body is kind of, you know, declining. You know, it's not bringing it into the bloodstream, and your body's not using it up. It's just sitting in your tissue, and now you have swelling. You're looking at the swelling. So that's an indication that the patient might be declining. Yeah, because even though they're drinking more, and maybe the family's pushing more IV fluids, you know, let's try IV, not drinking more. And then now you have these third spacing, right? As an indicative situation where the patient is declining. All right. Also, you can have patients that are depressed. I don't want to eat. I don't want to drink. Maybe they're in pain. They're constipated. We didn't look at the issue of the patient is constipated, and he doesn't want to eat or drink because he's in pain, or maybe they're depressed. Maybe they need their loved ones in there, right? And then sometimes too much medication, right? Polypharmacy, right? Certain types of meds will definitely impact the way you eat or drink, right? Chronic illness and then loss of mobility, okay? All right, so what are some of the interventions that we can do for these residents? We can certainly like change the environment, right? If there's a lot of, if we're sitting in a environment that's loud and there's too much noise, right? The resident is not gonna be able to focus and eat. For most of us, we can eat. Like when I get hungry, I don't care what kind of noise is out there, I'm gonna eat. For residents, when they really don't really want to even eat, and you have maybe the temperature's too cold, and a lot of your CNAs are maybe not even paying attention, maybe the TV's blaring, you have music playing, okay, you have lights that are coming in that's too bright. All these are significant factors that can affect the resident's ability to eat and drink, right? And you could just you could try on the resident, and you're like, man, he doesn't want to eat, and but maybe he's just uncomfortable, you know. So changing the environment, also changing the taste, right? Instead of serving water, maybe serving juice, right? Serving coffee. You know, this particular resident doesn't like to drink just regular water. You know, he likes to drink his coffee. So however way he can get fluids, you know, we want to encourage this intake of fluid in a different way, right? Being creative with the food and the drinks that you're serving, right? And then ask for PT or OT or ST evaluation, right? A lot of times, these guys in physical therapy, they specialize in their job function, and they can help resident out, you know, strengthening the muscles that's needed to swallow, you know, the right way, right? Also, maybe asking family members to come in. Maybe they're more comfortable with the family members to come in. They're more comfortable with a different CNA or a nurse, right? Maybe if they're having pain, give them some pain meds, right? Or try to figure out what's causing the pain. You know, constipation, maybe, right? So these are just interventions that we can take to try to increase, hopefully, the resident chances of drinking more, right? Hydration is what is dehydration? Basically, hydration is a life-threatening condition. It's considered an emergency. What are some of the symptoms that somebody is dehydrated?
Not drinking water.
Not drinking water? Okay.
Liquid.
Dizziness, right? Dizziness, right? What else?
Dry skin,
Dry skin.
wrinkly.
Tinting skin, right? Not going back. So if you have a nice skin that you're drinking a lot, right? This skin goes right back. If you're dehydrated, it's gonna tint. That's a tinting skin, right? It's gonna stay up there, right? But you may or may not know how to look at that, because that's like more or less like a nursing type of assessment. As a CNA, as a caregiver, what you can look at though that's easy to assess is their mouth, right? Their mouth could be dry, right? Also, dehydration can be like, if you're dehydrated and you don't have enough water in your system, you're gonna be lethargic, right? You can be confused, but also what's significant, and
Oh, I was gonna say, yeah, your brief is dry. Their brief
yeah,
is dry.
less
Yeah,
voiding, right?
That's, I mean, I really
But-
like when they're wet, because I know that they're drinking.
Think about your blood pressure when you have less water in your system. What happens to your blood pressure? It goes down, right? That might be this patient here, right? 2 days before he went to the hospital, I looked at his record, and there was an incident where his blood pressure was low, right? In a situation where your blood pressure, if you're dehydrated, your blood pressure might drop and your heart rate might go up, okay? That means that your heart rate is trying to compensate for your blood pressure, and it's gonna go up, but your heart rate, blood pressure might be down, okay? That's a clear indicative sign that you might be dehydrated, right? What else kind of sign with dehydration? What's your body go into? You have less water. You're gonna be sweating. What does sweating do? Keeps you cool, right? No, right? No, if you're dehydrated because you have less water, you're likely gonna be a little warm, right? You're gonna might have some fever, right? It might not be a high fever. You might have a low-grade fever, right? That's an indication of somebody who might be dehydrated as well, right? And these residents, like I said, for the most part, they're gonna be a little confused and lethargic as well, right? And so those are just clinical signs, basically, that your resident could be dehydrated. Factors that can cause dehydration, and so let's look at The factors that can cause dehydration. Okay, obviously, as she mentioned, if you're not drinking enough fluid, you can be dehydrated. But diarrhea can cause dehydration, right? What else? What else? Excessive urine output, right? If you're taking Lasix, right? Maybe you're voiding quite a bit, right? And and that can cause dehydration. Excessive sweat. What about vomiting? Nausea, vomiting, right? Those are factors that can cause dehydration. Presence of infection or fever, and cause dehydration. Frequent use of laxatives, enemas, diuretics, as you mentioned. Swallowing problems, which is goes on in hand with inadequate fluid intake, right? Comprehension, communication problems, body control problems, and then hand dexterity problems. These are some minor stuff. But the most important thing I think that we need to look at is if somebody has diarrhea, because that happens quite frequently. Or somebody who has a significant change in condition because they're not, before they were able to drink. Remember 34A used to be able to grab a cup and drink on his own? He can't do that now, right? He can't do that now. And maybe, just maybe, the person that's taking care of him just forgot that, hey, I gave him a cup of water. He usually picks it up, but now he's not able to do it. And then, he comes back not knowing that he's not able to pick up the cup. He's like, oh, he didn't want to drink today, so I'll take the cup back. So not that he didn't want to drink, it's the fact that he just can't pick up the cup anymore. He's physically declining. Okay, so we put these two together. I think the family was a little concerned that, hey, you know what, are we neglecting? You're neglecting my dad because he's dehydrated. On top of that, he's got this infection. What's going on? You had like a 1-2 punch here. So in reality, though, he was dehydrated. Okay, he was dehydrated because he was declining. Okay, now is that all of? Does that mean that it takes away responsibility? No, we should still be increasing fluid for this resident, and our documentation is going to be really strong on him, right? But the fact that he's got UTI is secondary to that, and I had to explain that to her. That, hey, it's likely that he's dehydrated. And he got an infection from dehydration, not because we neglected it in any way and we caused the infection, but if you do a culture and somebody's dehydrated, it's likely they have increased bacterial count in the bladder. Okay? All right. Any other things we can add in the care and prevention of dehydration? So I guess what we're trying to say, the most important thing here to remember is that it's important to keep your resident hydrated, especially during the summer. Okay, especially when somebody who's declining, and if indeed your resident declining and no longer able to drink, then we can show that through our charting, and in this situation, I think he was declining physically, but he could still drink. So we need to do our best to try to increase fluids and be creative, because that's what we're here for, right? We want to be creative in taking care of a resident, whether they're difficult with their behavior or they're difficult physically. We got to be creative in getting around that and figure out what their needs are physically and what their needs are, emotionally. Whether we need to, we need to accommodate them, physically and mentally, right? And you don't have to do it yourself. Right? I'm here, right? Social worker is here. Family members are here. Nurses are here. RNAs are here. This is not something that you can do on your own. Certainly, we can communicate and work together as a team, so that way, we can prevent these things from happening. Okay? Any additions to this? Right? Specifically, how to take care of somebody. Prevent. Our topic should be prevention anyway. Prevent dehydration. Prevent UTI. Right? If we were just focusing strictly on UTI, and prevention, that would be easy. But we're focusing mostly on dehydration here, because UTI, I believe that UTI was secondary. Okay. All right. So I do have a little test here, guys, and this is more or less the nutrition and hydration type of test. And so we'll go over real quick. Does anybody have any comments or suggestion on anything? All right, take care of residents. Do you guys have specific things that you do for residents to prevent, because you guys have been CNAs and nurses forever, right? What are some of the things that you can share with us? Right? Because I wanna be educated. I wanna be educated. I wanna learn some few things. You guys have got some skills you're gonna have to teach me. Because I'm gonna have to turn around and teach that to the rest of the crew here. What do you
What
have?
affects the resident the most is their behavior, and their behavior and everything is how you approach them.
That's
How
right.
you listen to them.
Listen to your resident, right? Communication is really important too. And you might have a change of mentation. As I said, acute delirium will cause confusion, and your communication with your resident is going to be really important. Okay, and you can choose to go the hard way, and hey, this resident's yelling at me, so I'm going to raise my voice too. Okay, you have to be the better man. I always say you have to be the better man, better woman, better staff, or whatever, because your resident is here for you to take care of, and we're not here to win an argument, right? And so, but yeah, you make a good point, and be the better person, and you know, and know that some of these residents, when they're yelling at you, it's likely they're trying to communicate something that they can't even understand, and they might have a change of mentation, right? They have acute delirium. They're not who they are 2 days ago, So, and they may return back to baseline 5 days later when we take antibiotics. But good point. What else? Any other addition? Okay, let's go over the test real quick. 1, list 3 interventions to improve resident food intake. So,
Change environment.
change of environment, yeah, right. Honor food preferences,
Food intake, how about make sure they're having their dentures on?
yeah, the dentures, right?
Their teeth.
Because you might have some pain or discomfort in your mouth,
Can't eat without the dentures.
yeah, and you might not want to drink, right? Okay,
Change the juice. If they don't want water, give them some juice. Give them a chocolate, give them something.
Give them options.
food preferences,
Give
there you
them
go.
options.
Right.
Yeah, give them options and preference. All right, offer substitutes.
Presentation also,
Presentation.
Mhm.
Yeah, they say
And
that.
colors. Sometimes if it's too bland, you have cottage cheese, you have mashed potatoes, everything on your plate is looking white, and you have fish or something, and that. So
It's not
color-
appetizing. It's not very appetizing. And also, if you have a pile of food there, you're 80 years old, 90-year-old man, right? And you're 80 pounds, right? And you're looking at this food like for the whole village.
Mhm.
Like, I'm not gonna eat that, man. Look at this,
Right.
right? So it's gotta be appetizing.
Portion control,
Yeah.
portion.
Yeah. Okay. 2, all residents, I don't know if we're gonna have to answer this. All residents are weekly. This is a way for us to really figure out if a resident is really, are losing weight or losing fluid, right? It's significant, but this is more or less for what do you call that? It's not the hydration, nutrition part, okay? So we're gonna skip 2.
Do you weigh your residents weekly?
Depends. It depends. There's a monthly, weekly, and there's a daily. So it depends on their diagnosis. So if you have a patient that has a cardiac issue, right, we're gonna do that
So your
daily.
daily,
We do
sure.
daily, right?
So your long-term residents are monthly,
Yes,
and your acute admissions are weekly.
that's right.
CHFers are daily.
That's right.
Okay.
Okay. Those are and then if we have the weight change, so what's significant? It puts a 1 or 2 weight change in a 24, 48-hour period. That's pretty significant, right? So we would call the doctor and see, try to figure out what's going on with this resident. Okay, like I said, the reason why you would be gaining weight, and we're going out of the way here and talking about residents with weight gain, but the reason why this most significant impact is that if your heart is failing, you're not gonna be able to pee this water out. Water weighs a lot in terms of weight, right? And so you're gonna have to start retaining this, right? And then plus if your diet is poor and you have sodium attracts water. Okay? That's why if you have a bad heart, stay away from sodium, because when you start eating this, say you eat adobo, right, with a lot of sodium. I eat a lot of adobo. Well, guess what? The sodium and water are gonna stick together, and they're not gonna come out. Okay? And they're gonna stick in my body no matter how much I pee. And it's gonna stay in there, and then you're gonna have, and then with the increased amount of water, you're gonna have increase in workload of your heart, and it affects your heart, and you're gonna go to the hospital likely for CHA exaggeration. All right, let's go to 3. Give 2 causes of dehydration.
Fever.
You have some fever, infection,
intake.
inadequate fluid intake,
Oral
right? As you
intake.
mentioned, right?
Mm-hmm.
What else? Diarrhea,
Good one.
vomiting, right? Vomiting, right?
That's liquid.
Yeah. Why do you think infection causes dehydration? Your body is working a lot, right? It's warming up, right? And a lot of times it's, you're sweating, right? If you have infection, you're sweating to your body try to compensate because you're warm. You try to sweat, right? You try to cool it down. With sweating, you're losing a lot of water, right? And that's the reason why you could be dehydrated. All right. So 4, 1 ounce equals to 60 cc. Is that true?
No.
1 ounce is 30 cc, right? That's right. So if you're looking at recording fluids for your resident, 30 cc is 1 ounce. List 2 interventions to prevent dehydration.
There's fluids and monitoring.
Intake and output.
Take an output, water at bedside, honor fluid preferences.
Offer
Um,
favorite liquids.
For fluids frequently. Okay. All right. Any questions, guys? Okay. Make sure you sign in. Get your CEUs here. Okay. That's right here. And then I will be posting this video online for some of the people that are missing.
Have you ever come